Dr. Bharat Pankhania joins me now from Bath in the UK. He's a senior clinical lecturer at the University of Exeter Medical School. Doctor, always good to have you on the News Hour. A lot of criticism there levelled against the CDC, but what's your assessment of how they've handled this pandemic?
So I have an interest in the Centers for Disease Control in that I did my additional training at the CDC in my time as well. The CDC is a wonderful organization, and it pained me a lot when President Trump was undermining the CDC throughout the pandemic. So the unfortunate thing that we see right now is that the CDC has been unable to deliver, but it has been unable to deliver because of political meddling. Political meddling in a very, very, very good, very expert organization. The other thing that the United States of America is not really good at doing is it works along very strict state boundaries. So it's almost like countries within countries. And because of those structures, there isn't that very rapid, fast coordination between CDC and all the other states that seem to operate autonomously.
Well, that also speaks, I suppose, to the size of the United States being one of the biggest countries in the world. And as you said, each state deciding on their own rules. What do you think they should be changing, though, especially going forward with many medical professionals expecting us to just have more pandemics in the future?
Well, I think even in the United Kingdom, we have the same problem whereby the Centers for Disease Control or the United Kingdom Health Security Agency are intertwined with ministers and government. And what we need all over the world is a robust, independent organization that can stand up to ministers. That would be the first thing, because otherwise there is a lot of bending of the protective, preventative, corrective measures that we would have liked to have done scientifically. The other thing is United States needs to do a lot more work, which is its data collection, its integration of IT systems isn't there. So give you one example, the mighty United States, with all the Twitters, the Facebook, the Intel, etc., they didn't have an application that would ping you if you had been a contact of a case anywhere in the country, whereas the United Kingdom did. So the United States, I'm afraid, is lagging behind in some of the technological developments that we've got elsewhere in the world.
Yeah, and you would think that being such a developed country that they would have those systems in place. Doctor, you mentioned there that we need a robust global organization, and that would make me think that the World Health Organization should be that organization.
It would be lovely if it was a robust WHO. And we know that the WHO is made up of member states, and the WHO is always often walking on eggshells. It has to be ever so careful not to upset any other big, especially the big member state. So the WHO walks very, very slowly, very gingerly, not to criticize China or the United States or other major donors. And again, the WHO needs to be empowered to stand alone, well-funded, but independent.
Dr. Pankhania, always good to speak to you. Thank you so much for your time.